My name is Dr. Teni Brown, and I'm an assistant professor in the Department of OBGYN at Northwestern Medicine in the Division of Female Pelvic Medicine and Reconstructive Surgery. My research interests focus on health disparities and disparities in treatment outcomes in urogynecology. This is one of my passions because I think that health equity is so critical to advance, and it's so important that we provide equitable care so that everybody benefits from our advances in our field. I am involved in several projects, both at the institution level as well as with some of our national organizations, to think about how we recruit people into our clinical trials to make sure that there's adequate representation from several racial ethnic groups, to make sure that our data and our results are generalizable. And then I'm also involved in some projects that are really geared at increasing access to care and access to our treatment modalities for all populations. My team and I are involved in several clinical trials. Some of those trials are part of large clinical trial networks that are national, that look at bladder health and lower urinary tract symptoms and how we prevent those and treat them. And then we're also involved in our own clinical trials that we lead at the institution. A lot of those trials are surgical outcome trials. And so what I mean by that is looking at our surgeries and how we can optimize them, looking at surgeries for apical repairs and urinary incontinence. Racial ethnic representation and diversity in clinical trials is critical for several reasons. First, it ensures that our results are generalizable. Second, it really shows an investment in all populations, not just the populations that are involved in those trials. And finally, we know that when we think about health disparities and health inequities, racial ethnic groups share certain social-cultural nuances, social determinants of health, and exposure to structural factors like structural racism. And so making sure that we have all populations involved or adequately represented allows us to look at health outcomes for all populations and not make erroneous conclusions based on data that's not generalizable. One of the conditions that I treat is urgency urinary incontinence. There are several treatments for this chronic condition, and one of the mainstays of therapy is oral medication. We have about 7 medications that we utilize for this condition, 6 of which contain anticholinergic properties. Recently, there has been mounting evidence that these anticholinergic medications have an association with cognitive side effects, particularly dementia. And so we are particularly careful in prescribing these medications, and we try to lean towards prescribing the medication that does not have these properties. This medication is a beta-3 agonist. Unfortunately, there's several insurance barriers to obtaining this medication, and this is one of the health inequities that I experience in my practice. And so there are women who aren't able to have adequate access to this medication or have to go through a lot to really have this authorized and obtain this therapy. So one of the things that we do is really take a very deliberate approach to patients with urgency incontinence to make sure that we are checking in. We have systems in our practice that really try to elucidate what barriers may exist to obtaining treatment options. And if a treatment is not successful, we really move patients efficiently on to advanced therapies. And so we don't have patients who are stuck with a treatment option that is not optimal for them and is expensive and not easily accessible. Since we know that there are disparities in access to our treatment modalities, like I mentioned with medication or even with pelvic floor physical therapy, which is another treatment option that we have for many of our conditions, my team and I, to address this issue, have recently secured federal funding to craft innovative solutions to increase access to conservative therapies for the conditions that we treat. When thinking about health disparities, health inequities, it's really important to have a holistic approach. And what I mean by that is we have to think about individual level factors, provider level factors, as well as system level factors, because we know that drivers of health inequities are multifactorial. My team and I are thinking about these things on several levels because that's where we're going to make the greatest impact in reducing health disparities.